Okay, so a very good evening, students. Good evening, Avinash. Good evening, Meena. Let me check whether it's working. Yeah, just checking so that you know we can start. Yeah, so it's working. Okay, so a very good evening, students. So, welcome to this 45 minute session on screening of disease. And it's whenever with this topic, whenever I have to teach, it's very important that we understand the concept behind this. When I say that the concept is important, once you have this concept, students, it becomes very easy to understand, it becomes very easy to solve questions related to that, and your confidence also gains because the epidemiology, screening, biostatistics, concept of health and disease, all these are topics which are, it's a concept based. If you have the concept, you will never be wrong. So before that, I'll just give you a small update on what we are doing as far as special class is concerned. Tomorrow also in the morning, I have a special class on previous year's questions on National Health Program, followed by the after tomorrow nutrition and demography and family planning. And in addition to this, I'm also involved in a last minute capsule course which is starting on 29. That is a plus course, so that will also help us to revise the last minute revision, which will be very important for the upcoming exam. So having said that, now let's start the today's topic. Students, we have to understand screening in the best possible way. So let's start to understand what is validity of a screening test. And let's make it so simple. And how it becomes so simple, students, take this. What is validity of a screening test? Ability of a test to distinguish between disease and those who are not disease. So when you are applying a screening test, the validity is just to differentiate between those who are diseased and those who are not diseased, right? There are two components of validity, students, as you all know: sensitivity and specificity. We keep on using these words on a regular basis: sensitivity of the test, specificity of the test. So whenever you are applying a screening test, to check the validity, you have to see sensitivity of that screening test and specificity of the screening test, right? So let's try to understand. Simple sensitivity, I'll give you an example. 100 people are diseased, right? Let's take an example. 100 people are diseased. We already know by the gold standard test or by the gold standard information, we already know 100 people are diseased. Now you apply a screening test, a new screening test on this 100 people, for example, and suppose 80 out of 100 is positive based on this screening test. So what have you done? This new screening test which you have applied, they have identified 80 out of 100 as positive, which is correct. So can I say sensitivity is ability of the test to identify correctly those who have the disease, right? So sensitivity out of total disease here, the example was 100. Out of that, the test was able to identify 80 as true positive. So that is my sensitivity. Simple, no? Let's take the second one. What is specificity? The ability of the test. You are applying a test. Now what is the ability of the test to correctly identify those who do not have the disease? Suppose 900, just I'm giving an example, 900 people are not having disease. You do a screening test on this 900. Out of this, the screening test says 800 is not disease. So the ability of this screening test was, out of 900, 800 are not diseased. So ability of the test to correctly identify those who don't have the disease is called specificity. Simple. Now let's take an example to understand in a best possible way, right? Let's take a population of 1000 students, right? Let's take 1000 people. Out of that, 100 are diseased. We have this information prior. We have this information that 100 people are diseased and 900 people do not have the disease. So there was a population of 1000, 900 do not have the disease and 100 have the disease. So on this population, you are applying a screening test, right? So suppose you apply a screening test on this and you get this number, students. I'll just explain this. 100 were diseased, already we know this. 900 are not diseased, we know that. And total population was 1000. We applied a new screening test and new screening test gave this values 80, 100, 20, 800. Just try to understand this. Now what I'll do, and you should always try to understand in this way, this heading is have the disease, means 100 people were diseased, so they are disease column. They do not have the disease means disease absent. If this is disease absent, this is disease present. And now you have applied the screening test. 100 people were diseased. Out of this 100 people, I find that 80. What is this 80? Try to understand this 80. I will not write anything. I will just tell you to match this row and column, students. The screening test here is saying positive and the column says have the disease. So what is the interpretation? 80 are those people who have the disease and the screening test is also saying that they are positive. Means they are diseased. Means screening test is also saying diseased and they are also diseased. So they are true positive. Simple. Now, so I'll show this. You see this, what is 80? 80 are those people who have the disease and the test is also saying positive. So they are true positive. Right? Now let's come to this next part. What is this 800? Think, students, just match the row and column. So 800 do not have the disease and the test is also saying negative. The screening test is also saying negative and they do not have the disease, means true negative. See, I have highlighted this, do not have the disease and the test is also saying negative. So this is my true negative. Okay, now let's come, what is 100 then? What is this 100? If you match the row and column, what you find? They do not have the disease, they are not diseased, but the screening test is saying positive. You are not diseased and the test is saying positive. So can I say it as false positive? So I got my false positive now. Now come to this 20. We are left with this 20 now. What is this 20? Again match the row and column. Have the disease and they have the disease, but the test is saying negative. When the test is saying negative and they have the disease, it means it is false negative, students. So this is the interpretation. How do you, so yes, it is right, true positive, false negative, true negative. But whenever there is a confusion, just try to match the row and column. You will get the correct information. What is true positive, what is false positive, what is false negative, what is true negative. Now once you know this, what is sensitivity? Out of total disease here, I'll just give you an example. What is sensitivity? Total people diseased are 100. Out of this, the screening test has given 80 as true positive. So out of 100, 80 are true positive. That is my sensitivity. Simple. Right? Now come to this part. What is this 800? 800 are those people who are true negative. Total negatives are 900. Out of that, 800 are true negative. So what is the percentage? 800 divided by 900, that is my specificity. So sensitivity is ability of the test to correctly identify true positive out of total diseased. Specificity is ability of the test to correctly identify true negative out of total not disease. When you know your sensitivity, when you know your specificity, you can also calculate your false negative and false positive percentage. What is false negative here? This 20. Why this is false negative? They are diseased, but the test is saying negative, so they are false negative. What is the percentage? Out of 120, so the percentage is 20%. Now come here, what is false positive? This 100, what is this 100? Match the row and column. They do not have the disease, they should be negative, but the test is saying positive, so they are false positive. So out of 900, 100 are false positive. What is the percentage? 11%. Simple mathematics. So whenever there is a confusion about this, always try to match the row and column. You will land yourself correctly. You will never be wrong. If I just put here, match this, have the disease positive, true positive. Match this, false positive. Match this, false negative. Match this, true negative. When you know this, it becomes easy. Okay. Now, if we have understood this, can we answer a few questions? Based on that understanding, is it helping us to solve the question? Because that is important. Now let's take one question. The probability of the test detecting a truly positive person from the population of diseased is what? Is it sensitivity? Is it specificity? Is it positive predictive value? Is it likelihood ratio? Anyone can answer this? The probability of the test detecting true positive person from the population of disease. So there is a population of disease given, right? It's given. In this population of disease, how many are true positive? So what is that called as? The probability of the test detecting a truly positive person from the population of disease. Definitely that is sensitivity. Just now we have discussed. So what is sensitivity? The ability of the test to correctly identify true positive out of total diseased. So that is my sensitivity, right? So that helps to solve the question. Let's take one more question. Specificity of a screening test is the ability of the test to detect. What is specificity? Ability of the test to correctly identify true negative out of total not disease. Student, that has to be always kept into mind. So whenever you are trying to differentiate between sensitivity and specificity, sensitivity true positive, specificity true negative, that is correct. But the denominator also has to be focused. Here the denominator will be out of total not disease. When you are calculating specificity, sensitivity, the denominator will be total diseased. So in this case, what is the answer? The answer is true negative. Specificity of the screening test is the ability of the test to detect true negative, right? Now, take this formula, study this formula carefully. True positive divided by true positive plus false negative into 100. What is this called as? Is it sensitivity? Is it specificity? Is it positive predictive value? Is it negative predictive value? So, let's take the formula. True positive out of true positive plus false negative. Have you ever thought, student, what is this? True positive means diseased. False negative. So in reality they are diseased. But the screening test has set them as false negative. So they are total diseased. And I have already said what is sensitivity? Ability of the test to correctly identify true positive out of total diseased. So this total diseased will be true positive plus false negative. Simple. So this formula indicates that it is sensitivity. Okay. Okay. Now, if you see sensitivity and specificity, so always there is one point. We are comparing with the gold standard. What is that gold standard? Means we already know, in the example which I gave, already I was knowing 100 people are diseased, 900 people are not diseased. So this is the external truth which we already have. And when we compare the new screening test, then we try to find true positive, false negative, or false positive and true negative. So this external truth or gold standard is already there, students, and then you are comparing and trying to find the sensitivity and specificity of the new screening test. Now, let's try to understand false positive. Have you ever thought, suppose false positive is there, what is the practical implication of false positive? Think, student, what is this false positive? I am not diseased. I am not suffering from disease. I am not diseased, right? But the screening test told me that you are positive. So suppose I am not suffering from COVID. Let's take an example of COVID. I am not suffering from COVID and the test says that you are positive. What will happen to me? I'll be anxiety. I'll suffer from anxiety. I'll be worried. I'll go to the hospital and I want to be 100% sure or get the treatment so that I can recover. I am not positive, but since the test has said me that positive, so I am false positive, so I am unnecessarily putting the pressure on the health system. So I am a burden on the healthcare system. So, but I am not diseased. So that is the implication of false positive. And I'll be worried, I'll be anxiety, I'll suffer from anxiety, I'll be unnecessarily troubling the health system to treat me, though I'm not diseased. Second, take an example here for children labeled positive. Suppose a children has been labeled that you are suffering from heart disease. Even after confirmation, if you know that the child was not suffering from heart disease, it is false positive, what will happen to this child? The family and the school where he studies, both will start treating him that no, maybe he is positive, let's not involve in his physical work, let's not let him play much because there was a possibility he may suffer from heart disease just because of that false positive information. So that is an issue of false positive. Now, if there is an issue with false positive, there is also issue with false negative also. It's not that false negative is very good. Suppose I am diseased and the test is saying, no, you're not diseased, perfectly fine, you're not diseased. So if I am diseased, test is saying that you're not diseased, so that is false negative. So what will happen, students? I will not go for the not timely treatment and my disease will further progress and the disease will worsen, will worsen. So false negative has also got implication. It's not that false negative is not important. So what we envisage that false negative and false positive should be less as far as possible. Now, we know true positive, false negative, true negative now. But have you ever thought, when you are applying a screening test, it always gives you two results only, students. It gives you positive and it gives negative. It doesn't give anything else. Only when you compare with the gold standard, then you come with false positive and false negative. But suppose you are applying a screening test and if you don't, suppose I take 1000 people and I do RBS, random blood sugar, right? So I'll say someone positive, someone negative. I'll give two results only, either positive or negative. It's only when you compare with the gold standard, then you come across whether someone is false positive or false negative, right? So in principle, the screening test always gives two results, positive and negative. Okay. Now, let's try to understand predictive value of the test. This is also important. Now, if the test is positive, what is the probability that the patient has disease? How much percentage you are confident that those people who are positive are diseased? Now think, what was sensitivity? Sensitivity, I said, out of total diseased, already diseased, out of them, how many are true positive? That is sensitivity. What I am saying here, the screening test gives positive result. Out of those positive result, what is the probability of having true positive? So that is predictive value. And so we are talking about positive, we are true positive, so it becomes positive predictive value. Let's try to understand this. Read this. What proportion of patients who test positive actually have the disease? Right? So total positive given was, for example, 100 positive. Out of this, 50 are true positive. So out of total positive, 50 are true positive. So this is my positive predictive value. Now come to negative predictive value. Total negative test, negative result given by the test is, for example, 900. Just an hypothetical example I am giving. And out of that, 800 are true negative. So this is my negative predictive value. Take the same example which I was taking in sensitivity and specificity. So this is 2 by 2 table already given. Now you see, students, sensitivity total disease is 100. So if I ask you what is sensitivity, so you will say, okay, 80 is my true positive. Let me write true positive, false positive, and true negative. So I ask you what is sensitivity, you will say 80 by 100. If I ask, this is my sensitivity. If I ask you what is specificity, okay, you will say 800 by 900. But when I ask you what is positive predictive value, so total positive prediction by this test is, students, 180. So total positive 180. Out of this, how much is true positive? So you should say 80 by 180. If I ask you what is negative predictive value, so negative prediction here, students, is 820. Out of this, how much are true negative? So it becomes 800 divided by 820. So this is my negative predictive value. So think, what is the, how many people have been tested positive? 180. Out of this, how many were true positive? 80. This is my positive predictive value. How many people have been tested negative? 820. Out of this, how many are true negatives? That is 800. So that is my negative predictive value. Right? So this is positive and negative predictive value. Okay, now let's take few questions whether that explanation is helping us to solve the question or not. For the calculation of positive predictive value of a screening test, the denominator is comprised of. So student, the question is saying positive predictive value. What is the denominator? If you remember positive predictive value, I said total positive. Out of this, how much is true positive? Now if I ask you what is total positive, it will be true positive plus false positive. Simple. Now you start taking the denominator. True positive, false negative, no. False positive, true negative, no. True positive, false positive, yes. This is my correct answer. So I'll go with an option C. So this is my positive predictive value. Okay. Let's take the next question and try to solve this. So we have 2 by 2 table given, and this is MI present, means myocardial infarction, disease, let's consider it as disease, and this is not disease. Positive ECG, negative ECG, values are given here, students. Now if I ask you what is this 300, so again use that same concept, match the row and column. People are diseased, positive ECG, this is my true positive. What is this 100? Match it. Positive, but disease is absent. This becomes my false positive. What is this? This is my false negative, and this is my true positive now. Now we have this information. The question is asking you whether sensitivity is less than specificity. So let's try to write. If I have to calculate sensitivity, students, sensitivity. So total diseased, total true positive is 300, total disease is 325, 300 plus 25. So my sensitivity becomes 300 divided by 325. I will not calculate, let's keep it there because they are not asking any value. They are asking more or less, right? Or same. Okay, let's try to calculate what is specificity. Specificity is total negative is 75 and total not disease is 175. 100 plus 75. So it becomes 75 divided by 175. Right? How I got 175? The 175, this is 175 here, 325, here we have 325. If you add in the rows, it becomes 400 and here becomes 100. So total is 500 students, right? Now, so I have my sensitivity, I have my specificity. They are also asking positive predictive value, negative predictive value. Put positive predictive value, calculate it. So it becomes 300 divided by 400. Total positive 400. Out of that 300 are true positive. So 300 by 400. Let's take negative predictive value. What is negative predictive value? 75. 75 divided by 100. Why 100? Total negatives 100. Out of that 75 are true negative. Now we have these values. We have put in this value. Now we'll try to compare. Is sensitivity less than specificity? Think student, 300 divided by 325 will be less than 75 divided by 175? No. So this is wrong. If sensitivity is not less than specificity, is sensitivity same as specificity? No, this value cannot be same as this value. So this is also wrong. Now, positive predictive value is 300 by 400. So can I write 3 by 4? Negative predictive value 75 by 100. So can I write here 3 by 4? What do you see now? Positive predictive value is equal to 3 by 4. Negative predictive value is equal to 3 by 4. Right? So I can say now positive predictive value and negative predictive value is same. So our answer is D. So what I'm trying to say with this question, students, if you have your proper understanding how to calculate positive, negative predictive value, sensitivity, specificity, all such questions becomes very easy to solve, right? Let's take one more question so that let's see whether we have understood properly or not. So see, a diagnostic test for a disease has a sensitivity of 0.9. Okay, I'll write here sensitivity value they have given 0.9 or 90%. Right. Specificity is also same, 0.9 or 90%. Right. A single test is applied to each subject in the population in which the disease population is 10%. So your prevalence is given 10%. What is the probability that the person positive to this test has the disease? It means they are asking you what is the positive predictive value. Okay, we have this information from the question. I have written it. Let's try to construct 2 by 2 table, students. I'll give you an example. I'll try to construct. It's very easy. Diseased, not diseased. This side I keep positive, this side I keep negative. This is the way we calculate. We try to construct our 2 by 2 table, students. Let's see. Right? We have this table now. What is the prevalence? 10%. Suppose the population is 100. So 10 people are diseased. Prevalence 10% means 10 people are diseased. So if I write total population as 100, 10% is the prevalence. So 10 becomes my diseased. If 10 becomes my diseased, what is this 90, students? Not diseased. 100 minus 10, 90. So I have my 10, 90, 100 value now. Now come to sensitivity. What is sensitivity? 90%. You know what is sensitivity? Ability of the test to correctly identify true positive out of total diseased. Total diseased is 10. 90% of 10 is 9. So 9 people are diseased. The moment 9 people are diseased, then total disease is 10. 9 people are true positive. So 9 minus 10 becomes 1. So this is my false negative here. And this is my true positive. So I got this 2 value. Now come to specificity. Specificity is also 90%. What is specificity? Ability of the test to correctly identify true negative out of total negatives. What is total negatives? Total not diseased people? 90. So 90% of 90 becomes 81. So 81 is my true negative. When I know my true negative, I know the total not disease. So if I subtract 81 from 90, it becomes 9. So 9 is my false positive, students. I got my 4 value, and now I'll add this, it becomes 18, this becomes 82, right? And now they're asking you, what is the probability that the person positive to this test has the disease? So total positive is 18, total positive is 18, out of this 9 is true positive. So 9 by 18 into 100, it is 50%. Wait, 50%. So our answer becomes 50%, which is C, right? So what am I doing, students? If you see, whatever my understanding is about sensitivity, specificity, false positive, false negative, positive predictive value, based on that I am trying to construct my 2 by 2 table, and I solve. I don't require any formula, it's very easy to solve, but the basic is, the important point is that you have understood the concept of positive, negative, sensitivity, specificity, positive predictive value, negative, then only you will be able to answer, right? Okay. Now, there is also try to understand positive predictive value and prevalence. What is the relationship between positive predictive value and prevalence? Please understand this. We know this if somebody asks. So we say as the prevalence increases, positive predictive value increases. We also say that the most means positive predictive value is most influenced by prevalence. Now let's try to understand how it is. What I'll do, students, I'll take a 10,000 population, right? There is a 10,000 population. Okay, and I'll take 2 prevalence. First prevalence is 1%. If I say the disease prevalence is 1%, total population is 10,000, then you can say, students, that 100 people, 1% of 10,000 is 100. So 100 people are diseased. When 100 people are diseased, so 9,900 people are not diseased. Simple, no? 1% is the prevalence, means 1% people are suffering from disease. 10,000 is the total population. So 100, 1% of 10,000 is 100. They are diseased. 9,900 are not diseased. Now, I have a screening test which has got sensitivity 99% and specificity 95%. Now, apply this to this concept, it will become easy. Sensitivity 99%. So, what is this? Ability of the test to correctly identify true positive out of total diseased. So, here total disease is 100, sensitivity is 99%. So, you can easily say 99 is your true positive. When your 99 is true positive, obviously if you subtract from 100, 1 becomes my false negative. Let's come to specificity. Specificity is what? 95%. What is specificity? Ability of the test to correctly identify true negative out of total not disease. Total not disease is 9,900. 95% of 9,900 happens to be 9,405. So this is my true negative. When I have my true negative, I have total not disease, I can easily get my false positive. Now I have these 4 numbers, I added in the rows 594, 9406, and I am trying to calculate positive predictive value. You can easily calculate 594 is the total positive, students. Out of this 99 is my true positive. So 99 divided by 594, you calculate the percentage, it is 17%. This is my positive predictive value. You can question me, what is this? You are just calculating. No, when 1% is the prevalence, my positive predictive value is 17%. Now student, what you do, increase the prevalence to 5%. Everything keeps same, don't change anything. 5% is your prevalence now. So 5% is the prevalence, so your total disease will be now 500. And then your total not disease will be now 9,500. Apply the same sensitivity test, 99% of 500 becomes 495, which is my true positive. When I know my true positive, I will easily know my false negative. Apply 95% specificity on 9500, you get 9025 as true negative. So you get your false positive also. Now you add this. Now you calculate the positive predictive value. Total positive is 970. When you add 495, 475, it becomes 970. So out of this 970 students, 495 is my true positive. Yes, true positive. So now if you calculate the percentage, it becomes 51%. When now compare, when you increase the prevalence from 1% to 5%, your positive predictive value also increased from 17% to 51%. So can I say positive predictive value is most influenced by prevalence? And I have proven with this example which I have shown here. Right? So higher the prevalence, higher the predictive value. Right? Now, always also think, students, you are applying a screening test. Suppose there is a disease which has got prevalence of 1%, and suppose there is a disease where the prevalence is 20%. Now think, if you apply a screening test here and you apply a screening test in this population, definitely screening test will help us in this population because the prevalence is high. So you will be having a better information. Why to waste our screening resources in a disease where the prevalence is very less? Suppose you go to a house and you say that I want to do a screening test for yellow fever in India. They will say, what are you talking? We don't have yellow fever in India. We don't have this disease. What screening you will do? They will not support you. But suppose you go to a family and you say that you are 45 years of age and I want to check whether you are diabetic or not. So let me check your blood sugar. Then the people may also respond to you, say, yes, I have seen many people suffering from diabetes. Yeah, it's good that you can check it. Maybe I don't know. Maybe I am suffering from diabetes. So the prevalence, when the prevalence is high, the screening test utility is also important. When there is no prevalence, what screening test will you do? It's not going to help, right? And when the disease prevalence is also high, the people will also support you, motivate you, and try to participate in your screening test, right? So this is the graph. As you increase the prevalence, your positive predictive value increases, and as just opposite becomes negative predictive value. As the prevalence increases, negative predictive value decreases, right? Okay, let's take few other questions so that we understand. Now read this question. The question is long, but the answer is very easy. I'll try to make it easy. In a group of patients presenting to a hospital emergency with abdominal pain, right? Abdominal pain. 30% of patients have acute appendicitis. So what I do, I write 30% of patient having acute appendicitis. I wrote this. 70% of patients with appendicitis have 70% of patient with acute appendicitis have temperature greater than 37.5. I wrote it. Whatever till this point I wrote. 40% of patient, again I write 40% of patient without appendicitis has temperature greater than 37.5 degree, right? So I have extracted the information from the question. Now considering these findings, which of the following statement is correct? They are asking you which of the following statement is correct. Now, first of all, let's come with the first part of the information. 30% of patient is acute appendicitis. Suppose there is a population of 100. So if 30 people are having acute appendicitis, what is my 70 then, students? 70 is not suffering from acute appendicitis. Now, so let's try to construct my diseased which is here acute appendicitis, not diseased, which is not acute appendicitis. So I write my total value, 30 is diseased, 70 is not diseased, total 100, right? Now, 70% of patients with acute appendicitis have temperature greater than 37.5 degrees Celsius. So let's take 37.5 in temperature, and means positive temperature I will take to make it simpler, and negative temperature means normal temperature. Right? I write here. Now, what is the question? 70% of patient with appendicitis has temperature greater. 70% of 30 students, 70% of 30, if you calculate 70 by 100 into 30, no? So it becomes 21. Just wait. It becomes 21. So 21 are my true positive. Why true positive? 70. Why? Because 70% of patient of 30 are having increase in temperature. So they are positive, true positive. So 21. So the moment I have 21, 30 is my total disease. So 9 becomes my false negative. Let's take the second part of the question. 40% of patient without appendicitis, means the 70, is having greater than 37%. They are not diseased, but the temperature is high. So 40% of, if I do 70, so it becomes 28. So 28 here is my false positive. When I have my false positive 28, so if you subtract 28 from 70, it becomes 42 is my true negative. True negative. Now you add students, it becomes 49. This becomes 51. So total is my 100. Now come to the options. So I have my 2 by 2 table, draft 2 by 2 table created. Let's see. Sensitivity of the temperature greater than 37.5 degrees Celsius 21 by 49. What is sensitivity based on our table? It is 21 by 30. 30. So, just wait. Yeah. So this is wrong. Specificity of the temperature is 42 by 70. Let's calculate our specificity. So our true negative is 42. Our total not disease is 70. Yes, this looks correct. C. Let's see C. Positive predictive value is 21 by 30. Based on our 2 by 2 table, it is 21 by 49. So this is also wrong. And specificity of the test will depend upon the prevalence. This doesn't make any sense. So our answer is B. Right? So yeah, the calculation was slightly big, but it was very easy, students. Why it become easy? Because we know each and every step. I know, first of all, what I did, I took how many people are diseased, 30%. So this is my disease. The moment I know 30% is disease, 70% is not disease. I know this. Now 70% of patient with appendicitis have temperature greater than. This is my true positive. 40% of patient without appendicitis have temperature greater. This is my false positive. When I have my information about true positive and false positive, I can automatically get my false negative and true negative. Then you calculate these values. Simple. And you'll get the information. Right? So, the concept, if the concept is clear, even if the question is long, slightly confusing, slightly complex, since your concept is clear, it will become easy for you to solve the question, students. Please go through this session. It is very important. It will help you to understand, make your concept. You can question why not this, why not that, why this is happening, why that is not happening. So this will definitely make your understanding very clear. Okay. So with that note, students, I'll stop here. Thank you. Take care, and we'll see tomorrow also. Tomorrow also I have class at 8:30 p.m. YouTube class on management techniques. Tomorrow morning also I have a class on National Health Program, which will be having previous year's questions. So if you are free, you can join. Thank you very much. Take care. Bye-bye.